All right, try number 2. This is a cool sculpting consult. I usually start with what are your thoughts and what brings you in today, and they tell me what body area they're interested in. And then I say, well, if we can pinch it, we can freeze it. And that means we can freeze and we can cool sculpt subcutaneous fat. Fat that is between the organs, or visceral fat, like those guys with the big beer bellies that are hard. We can't treat that. So it has to be pinchable and squeezable. Women have much more subcutaneous fat than men. In men, we typically only treat the lower abdomen and the flanks. With women, FDA approved from head to toe, basically. So we can do anywhere you can pinch some fat, we can freeze it. The way we target fat cells and not water-based cells is based on the freezing temperature. So when you take a bowl of water and you take a bowl of melted butter and put them both in the fridge and come back an hour later, the butter is hard and the water is still water, albeit cold. And that exemplifies the difference in freezing temperature. So the cool sculpting freezes to negative 11 degrees Celsius, which freezes the fat cell but makes the skin cells, muscle, bone, lymphatic, blood, makes them all really cold, but it doesn't freeze them. So when the fat cell is frozen, it expands just like an ice cube and it breaks the cell membrane. When that cell membrane is broken, the cell is dead and your body's immune system washes it away. And so results are permanent. Each round, each time you do it, it takes away 20 to 25% of the fat cells. So the first time, 20 to 25. The second time you do it, it takes 20 to 25 of what's left, getting you closer to a 35, 37.5 fat reduction. The difference between cool sculpting and liposuction with regards to results are lipo takes 40 to 60% of fat cells in the area. So I do like to manage expectations where I'd say about, well, I think they told you guys 60 to 80% of people are happier with 2 rounds versus just 1 round of cool sculpting. I have done 3 rounds on people, but any more than 2 rounds and you really want them to be considering liposuction as an option, because financially it's getting to the point where it might be a wash, unless there's somebody that would never consider something invasive like that. Most people can do it. Those that cannot do it have cryoglobulinemia, which is basically an allergy to the cold. It's where your blood agglutinates in the cold, and they don't tend to live in New England. If you have had surgery in the area that we're treating, so especially hysterectomy, C-section, gallbladder, any abdominal surgeries, they have to be 6 months out from surgery or longer, and they have to be void of any hernias in the area. Diastasis does not count as a hernia, but I do pay attention to diastasis recti postpartum, and I check the umbilicus for any hernias, and I check any scars for hernias. If you do have a scar that herniates or an umbilical hernia, you can kind of treat around it as long as you're not capturing any of that hernia in the applicator. You should be fine. So it's not a contraindication, it's just a consideration. Blood disorders or people who bruise easily do tend to bruise pretty significantly with cool sculpting. Again, not a contraindication, but something I do warn them about. There's a horse right there, so I got distracted. Those that are on aspirin, it's fine to treat as long as they're pre-warned. Anybody on things like Xarelto or Plavix, no. Like, we don't really do people like that. It's just not safe. And I would never tell anybody for any of the procedures we do to stop their aspirin. I just warn them about bruising, but they're on it for a reason. And God forbid if they stop it for something elective and then have a heart attack or a stroke, that's on us. So I don't ever recommend they stop it. Those are the only real contraindications. Raynaud's is a consideration. I've never had anybody with Raynaud's have any issue, but I always tell them, we have blankets, we have warm packs if you feel like your Raynaud's is being triggered. we can deal with that in the office. Those with low pain tolerances do tend to have issue with this. It hurts the most when you're going into the freezing and then coming out. So for the first 5 to 8 minutes of treatment, it can be uncomfortable. It feels like a burning cold, sort of like sticking your hand in an ice bath or swimming in, I used to say the Great Lakes, but we're now in New England, so swimming in the ocean in the spring. It's that biting cold. So your body registers as it as cold, and then it gets colder, and then it goes numb. So around 5 to 8 minutes, you're numb, and it's very comfortable. You can read, sleep, eat, talk on the phone. After each cycles vary between most commonly 35 minutes, 45 minutes, and least commonly an hour 15. They're comfortable for that time period, and then as the cycle ends, right away we do a 2-minute massage that makes it 68% more effective. So essentially, if we miss the massage, it renders it ineffective. And that massage is meant to break up any fat cells that haven't broken their own cell membrane. So when they freeze and expand, sometimes they don't break the cell membrane, the ones that are insulated from the front line basically, and I can go in and pop them, and that can hurt. So it's 2 minutes. I always tell people sometimes you have to close your eyes and breathe through it, but it's only 2 minutes, and it makes it so much more effective. And then after they leave, they'll be swollen, bruised, red, and it'll feel like a bruise, so it'll hurt when you touch it. It doesn't super hurt when you don't touch it, but that can last up to 2 weeks, usually 7 to 10 days. A small percentage of people can have post-treatment neuralgia, which is a nerve pain. So instead of symptoms getting better over the course of a week, by day 2, 3, 4, 5, they start getting worse, and that warrants treatment with a medication like Neurontin. So those with poor pain tolerances do tend to have issue with this, and so I'll preemptively give them a prescription. Like if they're kind of crying during treatment, I'll send them home with a prescription. Otherwise, I make sure they have the work cell phone to let me know as soon as possible, and I will call in something for them and see them and follow up. Rarely, 1 in 36,000 people can end up with PAH, or paroxysmal hyperplasia, paradoxical hyperplasia, where you end up with a bigger fat pad than what was originally treated. More common in middle-aged males of Mexican descent, being treated in the abdomen. No rhyme or reason to it. They don't know why. They suspect it's a overactive immune response, and these people have to be treated with liposuction. So the way that we protect ourselves and we protect them is by getting before and after photos and before and after weights, and then if that should be apparent on photo, as long as their weight is about the same, the company says they will reimburse for liposuction. I've never seen it, my rep's never seen it, but it is something you have to tell people about because it can happen. So that's the importance of before and after weights. Cool sculpting does not change your weight on the scale. Subcutaneous fat does not contribute or add to weight gain or weight loss. Visceral fat mostly does. So with the amount we're taking away in the surface area, and the fact that it's subcutaneous fat means we're not really making a difference on the scale. I suppose if you were to cool sculpt yourself head to toe twice, maybe you'd lose a couple pounds, but that's not your really reality. We have the same number of fat cells. They're set in adolescence by various factors. Unless you hit obesity, morbid obesity, let's say you have 10 fat cells, you always have 10. So those 10 get bigger as we gain weight, smaller as we lose weight, but we always have 10. So if I now take away 2 to 2.5 of those 10 fat cells, I now always have 7.5 to 8 fat cells that get bigger and smaller with weight gain and loss, but I always proportionally have less. The only time that gets thrown out the window is with obesity, morbid obesity. So if you've ever seen the show like Biggest Loser or My 600-Pound Life, those people really do have to exercise longer and eat less than the average person because they have added fat cells. That's how it works. Side effects, contraindications and considerations. I think that's it. I think that's all I go through. Let me think. Where we can treat, who's a candidate. We usually do 2 rounds. We always offer a price break on the second round, 40% off the first package price, and the prices change. They're a little less. So those papers that show the new prices are at the front desk. Most people who are of a normal BMI, we treat no problem. They have to be within 30 pounds of their goal weight, because with those 10 fat cells, let's say we have, if those 10 fat cells are humongous, I can only fit 1 or 2 of those fat cells into the applicator. Whereas if they're 30 pounds lighter, I can then fit 2.5, if that makes sense. So it has to do with surface area. When the fat cells are so big, the treatment is rendered less effective. So we like people to be within 30 pounds of their goal weight, except for chin. Chin doesn't really matter. I think that's it. If I think of more, I'll do another video, but that's generally what I say during consult. Okay, bye. Hopefully this works now.